Thank you. Good morning to everybody. I would start just distinguishing about modalities of stenting and bifurcation. We should, I think we agree that simple stenting and complex stenting are different subsets. And what we are speaking about, that means in bifurcation, a kissing balloon, is not regarding complex stenting because, as you see, all strategies include a step with kissing balloon inflation if we are dealing with complex stenting. So no discussion. If you are doing two-stent technique and complex stenting, then kissing balloon inflation is mandatory and should be done. Now, simple stenting. Why kissing balloon inflation was introduced? To keep side branch open and avoid periprocedural side branch occlusion, to optimize the stent expansion, to cover the side branch ostium, to correct stent deformation, to keep access to future intervention as well. And mechanism of side branch occlusion, we know that it is black shift, carina shift, side branch dissections, path, thrombus formation, and others. And of course, the deformity of stent is caused if you are crossing to side branch with a large balloon and inflated the balloon, then you have dislodgement of the stent on the opposite side of side branch, and this can be corrected with the kissing balloon, as well as jailing strut can be removed and with kissing balloon, and this will be reducing stent thrombosis as well. And of course, if you have some flow impairment and FFR is positive for ischemia, then kissing balloon can improve FFR and at side branch. So it seems that kissing balloon inflation is good. Should we do it always? I think no, because it is not perfect, at least in conventional stenting. And kissing balloon inflation has some limitation as well. Now, if you look here, after kissing balloon, you see that there is some deformation of the stent and that some malapposition in the proximal part of the stent. It depends on the location of the wire to side branch crossing. That also depends on the type of the stent and link on the stent, that being peak to valley link or peak-to-peak link, and this is translated in daily practice to what you see here on OCT. Whether you are crossing proximally or distally, it depends on the location of the link, and you might end up with suboptimal result as well, whether you are crossing distally or proximally. And again, if you are the overlapping of balloons can also cause dilatation and gap formation, as you can see in this scheme, and keep some part of the wall vessel uncovered by the stent. And of course, minimal overlapping will give more conformable stent to the bifurcation than long overlapping. And if we look on what is coming from the clinical trials in daily practice and from studies, we can see that if we are dealing with provisional stenting, that means simple stent, then kissing balloon inflation is not affecting, and even it might be harmful because it is worse than is doing work. Patient with kissing balloon inflation is doing worse than without kissing balloon. This is true for provisional stenting, but it's not true for two-stent techniques. You see that kissing balloon inflation in two-stent technique strategies is doing much better than without kissing balloon inflation. Kissing balloon inflation, again, coming from other trials like Excel trial, the conclusion was it's not affecting the outcome. Again, this is a very large registry from Japan, for distal lift main bifurcation, and showing that no impact of kissing balloon inflation on the clinical outcome. It's even if target lesion revascularization or total MACE are quite equal. And this is another meta-analysis showing the same results, that mean no difference between kissing balloon inflation and non-kissing balloon inflation in provisional stenting. And this is another study from our group showing again that only a two-stent technique is benefiting from kissing balloon inflation. The alternative to kissing balloon have been proposed recently: pod, side branch, then pod to side branch, pod, that means another pod, final pod. But actually, we do not have that much data supporting all these alternatives. What we have today is something on pod, of course, which actually can be predicted by intravascular imaging, particularly in big bifurcation lesions. This depends on the angle of the tip of the carina and the distance of the tip of the carina from the opposite side of side branch. And of course, the stent sizing in bifurcation should be based on the distal part of main vessel rather than the proximal part, because if it is big stent, then will cause carina shifting. If it is smaller in the proximal part, can be corrected by inflation of bigger balloon, what we call pod. And the pod also can facilitate correct the stent malposition in the proximal part of main vessel, facilitate recross distally, and also after pod, if you need to do kissing balloon, then the gel struts can be moved to the side of side branch. Now, we have some data from Corby's 2 pod study showing the beneficial effect of pod in all subgroups of patients. And again, this is another proposal from bench study that means to repeat pod after side branch dilatation, that means repod, and showing that this will, the same authors are having some clinical data showing the beneficial effect of repeating pod after side branch dilatation if needed. What I would say that all we agree that today provisional stenting is put a stent based on the distal diameter of main vessel, do your pod. If no compromise on side branch, your procedure is finished. You don't need to recross for the side branch. That means no compromise means that you don't have any impairment of the flow or any angina or any ischemic sign on HEG. If you have something on some compromise, then recross, side branch, repeat pod, and this is the final thing. So in provisional stenting, kissing balloon inflation is not mandatory, but when it's required, you should do it very correctly, not overlapping too much the stents. So my final remarks is in single stenting, avoid unnecessary final kissing balloon. Inflation or pressure wire interrogation should be used when an angiographic significant side branch compromise remain after main vessel stenting. Optimization of provisional stenting in bifurcation lesion by alternative techniques can provide more appropriate stent expansion at a position and better clinical outcome. When kissing balloon inflation is performed, final pod should be performed in order to ensure optimal stent expansion at the position. And I finish saying that final kissing balloon is mandatory, plus pod is mandatory always when you are performing a two-stent technique. Thank you very much for attention.